Mercury rubs for syphilis. Throughout the 15th century, a terrifying disease began spreading across Europe. Syphilis moved from city to city, leaving suffering and fear in its wake. For those infected, the symptoms started with painless sores and rashes, but gradually became much worse. Doctors and healers were desperate to find a cure for this new affliction. By 1495, physicians in major European cities started using a treatment that seemed promising, but would prove deadlier than the disease itself: mercury. Jean Fernel was a 30-year-old baker from Lyon, France. After contracting syphilis from a local brothel, his condition deteriorated rapidly. The pustules on his skin became unbearable. He sought help from a well-known physician who prescribed the most advanced treatment of the day: mercury rubs. The treatment involved mixing elemental mercury with animal fat to create an ointment that was then vigorously rubbed into the skin. At first, Jean felt relief. The visible sores began to dry and fade. What he didn't know was that with each application, the toxic metal was being absorbed through his skin and into his bloodstream. Within weeks, Jean began experiencing new symptoms. His gums became inflamed and started to bleed. His teeth loosened in their sockets. He developed a persistent tremor in his hands that made his work as a baker increasingly difficult. Soon, Jean started experiencing severe stomach pains. He couldn't keep food down. His weight dropped dramatically. The physician assured him these were just signs the mercury was drawing out the disease. But the reality was far more disturbing. The mercury was destroying Jean's kidneys, damaging his nervous system, and poisoning his brain. In his final days, Jean experienced violent seizures. He lost control of his bladder and bowels. His mind slipped away as the neurotoxin attacked his brain. Witnesses described how he babbled incoherently, no longer recognizing family members. As mercury levels in his body reached lethal concentrations, Jean's organs began shutting down one by one. Within 3 months of beginning treatment, Jean Fernel died in agony, his body ravaged not by syphilis but by the very cure meant to save him. Bloodletting of King Alfonso XI of Castile. On March 26, 1350, Europe lost one of its most powerful rulers not on the battlefield, but to a microscopic enemy. King Alfonso XI of Castile had earned the nickname the Avenger for his victories against the Moors. The 40-year-old monarch was besieging the Muslim-held city of Gibraltar when the Black Death arrived in his camp. The plague had been sweeping across Europe for 2 years, killing millions in its path. When Alfonso developed the telltale symptoms, fever, painful swellings in his groin and armpits, and blackening skin, his royal physicians immediately prepared for the standard treatment: bloodletting. Medieval medicine was dominated by the humoral theory, which held that the body contained 4 humors: blood, phlegm, yellow bile, and black bile. Disease was thought to result from an imbalance. The king's physicians believed draining his excess blood would restore balance and purge the illness. The procedure began in the royal tent. Alfonso was stripped and held down by attendants. Using a sharp blade, the physician opened a vein in the king's arm. Blood flowed freely into a bowl while court members watched silently. Once that vessel was drained, another cut was made. Then another. The king grew paler with each procedure. Rather than improving, his condition deteriorated rapidly. Still, the physicians persisted, convinced that not enough bad blood had been removed. By the 3rd day, Alfonso was too weak to stand. The buboes, swollen lymph nodes, continued to grow, turning black as the infection raged through his body. What the physicians didn't understand was that the Yersinia pestis bacterium causing the plague was multiplying in Alfonso's bloodstream. Each bloodletting session only weakened his ability to fight the infection. As his organs began to fail, Alfonso struggled for breath. His lips turned and they blew. Court chroniclers recorded his final delirious words, pleading for water to quench an unrelenting thirst. On the 6th day after symptoms appeared, the King of Castile died, his body drained of blood, but still filled with the bacteria that no amount of bloodletting could remove. Failed couching procedure. In the winter of 1326, Thomas Alcott, a 58-year-old wool merchant from York, began losing his sight. A milky film gradually covered both his eyes, cataracts that dimmed the world around him. By spring, he could barely distinguish light from shadow, a devastating condition for a man whose livelihood depended on judging the quality of textiles. Desperate to regain his vision, Thomas sought the help of a traveling surgeon known for performing a procedure called couching. This technique had been used since ancient times and was the only option for cataract sufferers. The surgeon assured Thomas that many patients regained their sight immediately after the operation. What he failed to mention was how many died from what came after. On a bright May morning, Thomas sat on a wooden stool in his home. The surgeon's assistant held his head firmly while neighbors gathered to witness the procedure. No pain relief was offered beyond strong ale. The surgeon withdrew a long, sharp needle designed specifically for eye operations. With steady hands, he approached Thomas's right eye. The needle pierced the white of the eye, entering just behind the colored iris. Thomas screamed as the point penetrated deeper. The surgeon worked the needle back and forth, pushing the clouded lens down and away from the pupil. Blood mixed with clear fluid leaked from the puncture site. When the surgeon finally withdrew the needle, Thomas claimed he could see shapes again, though indistinctly. Within 2 days, however, Thomas developed a searing pain in his eye. The white turned angry red, then began to leak yellowish fluid. The infection spread rapidly to his left eye as well. Fever gripped his body. The surgeon, having already moved on to the next town, was nowhere to be found. By the 10th day, the infection had spread from Thomas's eyes to his brain. His wife described how he thrashed in agony, crying out that his head was being split open from within. The putrid smell from his eyes filled their small home. Delirious and blind, Thomas clawed at his face until restraints were necessary. On the 12th day after the procedure, Thomas Alcott's breathing became shallow, then stopped altogether. Deadly Dwale anesthetic. In August 1279, Eleanor Thatcher, a 32-year-old mother of 3 from Norwich, developed a painful swelling in her right leg. The condition worsened until the limb turned black with gangrene. The local barber surgeon declared the only chance of survival was amputation. But first, Eleanor would need to be rendered unconscious with a potion called Dwale. Dwale was a mixture brewed from bile, opium, hemlock, henbane, and mandrake, all potent and unpredictable plants. It was the medieval equivalent of general anesthesia, but unlike modern medicine, there was no way to measure dosage with precision. Too little, and the patient would feel everything. Too much, and they would never wake up. On the morning of the procedure, Eleanor was brought to the surgeon's chamber. A crowd gathered to watch. Medical procedures were public events in medieval times. The surgeon's assistant presented Eleanor with a wooden cup containing the murky Dwale mixture. She hesitated, knowing some patients never awoke, but the alternative was certain death from the spreading infection. She drank it all. Within minutes, Eleanor's eyes grew heavy. Her speech slurred, then stopped entirely. Soon, she lay motionless on the table. The surgeon tested her consciousness by pricking her good leg with a needle. When she didn't respond, he began the amputation. As the procedure progressed, witnesses noticed something alarming. Eleanor's breathing had become shallow, almost imperceptible. Her face had taken on a bluish tint. The surgeon, focused on removing the leg, didn't notice these warning signs. By the time the amputation was complete, Eleanor's pulse had grown faint. The surgeon attempted to rouse her by applying burning feathers beneath her nose, a common revival technique. There was no response. Cold water splashed on her face yielded nothing. Her breathing slowed further, then stopped completely. The surgeon continued his efforts for nearly an hour. Eventually, he was forced to admit what many had already realized. The Dwale that was meant to spare Eleanor from the pain of surgery had instead stopped her heart. The concoction had been too strong, overwhelming her body's vital functions. Eleanor Thatcher would never wake up, never see her children again, her final sleep induced by a medicine more deadly than the disease it was meant to treat. Trpanning Death. In the early summer of 723, at a Benedictine monastery near Fulda, Germany, a 45-year-old monk named Brother Adalbert suffered from unbearable headaches. For weeks he described the pain as demons pounding inside my skull. When herbal remedies and prayers failed to bring relief, the monastery's infirmarian suggested a procedure that had been performed since prehistoric times: trepanning. Trepanning involved drilling a hole in the skull to release evil spirits or pressure believed to cause ailments. Despite its brutality, it was considered a legitimate treatment for severe head pain, seizures, and mental disturbances. The monastery had a visiting surgeon who had performed the procedure several times before. On June 12th, Brother Adalbert was brought to the infirmary. Fellow monks held him down while the surgeon marked a circle the size of a coin on the right side of his shaved head. No pain relief was available beyond strong wine and a leather strap to bite down on. The surgeon used a specialized drill called a trephine, placing its center point against Adalbert's skull and beginning to rotate it with steady pressure. The sound of the drill grinding against bone echoed through the room. Blood streamed down Adalbert's face and neck. He screamed until his voice gave out, then continued to moan as the drill slowly penetrated his skull. After 20 agonizing minutes, the surgeon removed a disc of bone, revealing the pulsating tissue beneath. The procedure appeared successful. The bone fragment was removed without visibly damaging the brain. Brother Adalbert, though weak, remained conscious. The wound was covered with a poultice of honey and herbs, then bandaged. The monks praised God for guiding the surgeon's hands. By the 3rd day, however, something was clearly wrong. Brother Adalbert developed a high fever. The wound site turned red, then began to ooze yellowish fluid. He complained that the pain was worse than before. By day 5, he could no longer recognize his brothers or speak coherently. The infection spread rapidly from the wound into the brain tissue beneath. Pus accumulated between his skull and brain, creating increasing pressure. Brother Adalbert began having seizures. On the 7th day after the procedure, as the morning prayers began, the monk's body stiffened one final time, then went completely limp. The hole that was meant to release evil spirits had instead become a gateway for something far more deadly: bacteria. Poisoning of Ulrich von Hutten. By 1523, Ulrich von Hutten was a celebrated German scholar, poet, and reformer. At the age of 35, he had already published numerous influential works and fought alongside knights in battle, but privately, Ulrich suffered from a disease that ravaged his body, the Great Pox, or what we now call syphilis. Ulrich had contracted the disease years earlier. It began with painless sores that seemed to heal on their own. Then came the rashes, followed by painful ulcers that spread across his skin. The disease attacked his bones, causing excruciating pain that kept him awake through the night. As a man of learning, Ulrich documented his suffering in vivid detail, creating one of the most thorough accounts of syphilis treatment from the period. In 1522, after trying numerous remedies, Ulrich turned to the most prominent treatment of the time, a dual approach using mercury compounds and a wood extract called guaiacum. His physician prepared mercury pills and ointments, assuring him that the metal would draw out the disease. The treatment began immediately. Within days, Ulrich experienced what his doctors claimed was a positive sign: profuse salivation, his mouth filled with saliva constantly, sometimes producing up to 2 quarts of fluid daily. This was actually mercury poisoning beginning to take hold, though physicians believed it was the disease being expelled from the body. Soon, Ulrich's gums became ulcerated, his teeth loosened and began to fall out. He experienced severe stomach pains and uncontrollable shaking in his hands. Still, his doctors increased the dosage, convinced the treatment was working. They supplemented it with guaiacum, a wood from the New World that required the patient to fast and sweat in overheated rooms while drinking the bitter extract. By summer 1523, Ulrich had retreated to the island of Uffenau on Lake Zurich. His condition had deteriorated drastically. The mercury had damaged his kidneys, causing him to swell with fluid. His mental faculties began to fail as the toxin affected his brain. He could barely speak, his words slurring as his nervous system deteriorated. On August 29, 1523, a servant found Ulrich unresponsive in his bed. His body was emaciated, his skin marked with the dual ravages of syphilis and mercury poisoning. The treatment that promised to save his life had instead delivered him to death's door, then pushed him through. Fatal Purgation of King Charles II of England. On February 2, 1685, King Charles II of England rose from his bed as usual. At 54, he was still vigorous and healthy. After shaving, the king suddenly staggered, his speech slurred. His face contorted as he collapsed into a servant's arms, seized by violent convulsions. Within minutes, the royal apartments erupted into chaos. A dozen royal physicians rushed to the king's bedside. They diagnosed apoplexy. What we now know was a stroke. What followed was not a single treatment, but a barrage of interventions that demonstrated the full, brutal arsenal of 17th century medicine. The physicians began with bloodletting. They opened a vein in the king's arm, draining 16 ounces of blood. When his condition didn't improve, they cut open another vein, then another. In total, they removed nearly half the blood in his body over 3 days. Each session left the king weaker than before. Next came the purgatives. Charles was force-fed powerful laxatives and made to swallow antimony, a toxic metal that induced violent vomiting. His body was racked with spasms as the physicians sought to expel the corrupted humors they believed were causing his illness. The king's head was shaved, and blistering agents were applied to his scalp, feet, and thighs. These chemicals burned his skin, creating painful oozing sores that the doctors believed would draw out the disease. Sneezing powders were blown up his nose to wake his brain. Perhaps most bizarre was the administration of King's Drops, a special cordial containing ammonia and powdered human skull. The ground bone came from someone who had died a violent death, believed to contain powerful healing properties. The potion was forced down the king's throat as he drifted in and out of consciousness. On February 6th, Charles briefly regained lucidity. Looking at his physicians, he apologized for being such an unconscionable time dying. Hours later, his breathing became labored. His kidneys had shut down from the combined assault of toxic medicines and blood loss. His lungs filled with fluid. By evening, King Charles II slipped into a final coma. The king who had survived civil war, exile, and multiple assassination plots could not survive his own doctors. Mummy powder, cure of mummia. In 1582, Edward Wyndham, a 40-year-old merchant from Bristol, England, suffered a serious fall from his horse. The impact ruptured something inside him, causing him to cough blood and experience intense abdominal pain. Fearing death, Edward sought the help of the most reputable physician in the city, who prescribed what was then considered the ultimate remedy for internal injuries: Mummia. Mummia was not just any medicine. It was literally ground-up human remains, specifically Egyptian mummies, pulverized into a fine powder. The belief was that the preserved bodies contained powerful healing properties that could be transferred to the patient. By the 16th century, the demand for this macabre remedy had created an entire industry of tomb raiding and counterfeit production. Edward's physician assured him that Mummia would seal his internal wounds and restore his vitality. What neither knew was that the medicine Edward received wasn't from an ancient Egyptian tomb. It was ground remains of a recently deceased criminal, hastily processed with bitumen and herbs to resemble genuine mummy powder. The treatment began immediately. Edward was instructed to mix the dark gritty powder into wine and drink it 3 times daily. The taste was revolting, bitter and putrid, but he forced it down, desperate for relief. For the first 2 days there seemed to be improvement. The bleeding slowed, and Edward took this as a sign the Mummia was working. On the 3rd day, Edward developed a fever. By nightfall, he was shivering uncontrollably despite the warm summer air. His family applied cool cloths to his forehead as he drifted in and out of consciousness. The physician ordered more Mummia, convinced that higher doses would overcome whatever new ailment had taken hold. What Edward and his doctor didn't understand was that the mummy powder was teeming with bacteria from the poorly preserved corpse. Each dose introduced more pathogens into his already weakened body. The primitive embalming process used by the counterfeiters had preserved not just the flesh, but deadly bacteria as well. By the 5th day, Edward's abdomen had swollen dramatically. Dark red streaks spread across his skin, signs of blood poisoning that no one recognized. His breathing became labored. In his final hours, he suffered agonizing cramps as the sepsis spread through his body. The medicine meant to save his life had introduced an infection far deadlier than his original injury. Edward Wyndham died not from his fall, but from consuming the putrid remains of another human being.